Pop quiz. A male client is admitted to the neurological ICU after sustaining a head injury from a hiking accident. The client is unconscious, his pupils are non reactive, and the nurse caring for this client recognizes that which of the following interventions is contraindicated? 1. Administering a barbiturate. 2. Performing a lumbar puncture. C. Placing the client on mechanical ventilation. Or 4. Elevating the head of the bed. 1, 2, 3, 4. Okay. Which one is contraindicated? And guys, the correct answer is 2, performing a lumbar puncture. Why? Let's go back to the question. The patient's in the neuro ICU. That should be your first hint of what you should suspect is happening. After sustaining a head injury, that is your second hint. And third, the pupils are non-reactive. What are you suspecting is going on with this patient? ICP, right? So if the patient has increased intracranial pressure, or it's even suspected that they have increased intracranial pressure, a lumbar puncture is going to be contraindicated. Why? It can decompress the CNS and cause even worse ICP. So we're not going to do that. Now let's look at the other options. We didn't choose it because it's not contraindicated. 1, administering a barbiturate. Why not? A barbiturate is going to decrease the cerebral blood flow, which will also decrease ICP. Nothing wrong with that. 3, place the client on mechanical ventilation. Yeah, they're unconscious. They're non-reactive. If they're respiratory, we don't know what the respiratory status is right now, but guess what? They're going to be on mechanical ventilation. And even if they weren't before, in case that patient's status deteriorates, they're absolutely going to need to be on mechanical ventilation. There's nothing contraindicated about that. And last, elevating the head of the bed. This is where you guys go wrong. I know so many students who would choose 4. It didn't say elevate the head of the bed to 90 degrees. All it said was elevating the head of the bed. And guess what? A patient with head trauma that either has increased intracranial pressure or they're suspected to have increased intracranial pressure, you're going to have the head of the bed elevated 15 to 30 degrees. You're going to have the body and the head in a neutral, aligned position, no flexion, no rotation, neutrally aligned, but elevated 15 to 30 degrees. So the only thing here that's contraindicated is performing a lumbar puncture.